Just last week, Western Mass News told you about the Springfield Fire Department's commissioner cracking down on a huge uptick in the use of fireworks, which here in Massachusetts are illegal. Today, Baystate's Medical Center's Chief of Disasters Medicine is weighing in, saying they too are seeing an increase in firework-related injuries. Beth Ward joins us live from her home with the latest.
Well, Sarah, you could say it's logical, right? A rise in illegal fireworks, not just in Springfield, but in cities and towns all across Western Mass, is translating to a rise in related injuries. And that is exactly what they're seeing at Baystate Medical Center.
Are we seeing injuries in the ED? Yes.
Dr. Gerald Beltran is Chief of Disaster Medicine at Baystate Health. He is board certified in emergency medicine and emergency medical services. All that means he has seen it all in the emergency department. And right now, he says he's seeing more fireworks-related injuries than he has seen in years past, and earlier in the summer than in years past.
People have been pent up for a little bit. I mean, we kind of talk about COVID. People are looking to get outside and, do something.
The results, he says, are a wide range of injuries.
I've seen them, because there's a loud detonation, you do have problems with your tympanic membrane, your eardrum, that can rupture. You can lose hearing from that. Seen eye injuries, burns to the eyes, burns to the face, burns to the hands, fingers that have been partially taken off the hand.
Even severe burns and other injuries from something as small and popular as sparklers.
People don't realize that those run about 1,000 to 2,000 degrees Fahrenheit. I mean, that is boiling water is at X number of degrees. Think of how hot that is. That's molten metal.
What people may not know is that some fireworks-related injuries must be reported.
We're required to report burns, and that's required under the mass regulation. So anytime any hospital gets a patient who has a burn, we have to report that.
Reported to local law enforcement and to the Massachusetts Burn Injury Reporting System, or embers, which says in the last decade, 38 people were treated in Massachusetts emergency rooms for severe burn injuries from fireworks. More than half were children, the youngest a 6-month-old boy.
Well, to be clear, in New Hampshire, all fireworks are allowed. In Connecticut, the only ones that are allowed are things like sparklers and fountains. And on a side note, in Boston, city police say calls about fireworks use were up in May 2,300% over last year. Reporting live from home, Beth Ward, Western Mass News.